Tumors of the pituitary gland are usually benign tumors, but they have a risk that as they grow, they compress the optic nerve. The tumors of the pituitary gland, by and large, don't produce a hormone, but some of them will produce a hormone. And the ones that produce a hormone will cause, for example, if they produce the growth hormone, will produce growth of your hands and your face, and overgrowth of several anatomical structures. There may be a risk of having overgrowth in your heart and conditions of the heart related to that. In that event, in a confirmation with lab tests and MRI that you have a pituitary tumor, surgery is an option. Tumors that produce the ACTH, which is a hormone that is produced in the pituitary gland that controls your supraadrenal gland, controls your blood pressure and the gain or loss of weight, have a condition called Cushing disease. The patients will be overweighted with a hump in the back of the neck, with overgrowth of hair in their face, and severely high blood pressure. Those patients we find that they have overproduction of ACTH and a small tumor. Sometimes it doesn't even have to be a big tumor, and those could be treated with surgery. Lastly, and the most frequent, is tumors that do not produce anything, but the mass or the size of the tumor compresses the optic nerve. And sometimes they compress the optic nerve and the patient doesn't have visual problems, but they can die or stroke or bleed into itself and produce sudden loss of vision. So all those are the indication for transsphenoidal, transnasal pituitary surgery. Today we do that operation with endoscopic technique through the nose. With the navigation computerized system, we navigate through the nose to the base of the skull, and we open a little window on the base of the sella. It's like a chair where the pituitary gland sits. And as we open that, we essentially suction out the tumor and relieve the pressure of the optic nerve. The surgery will probably be no more than 2 hours. Patients are observed in the hospital overnight. If there is no other problems from the endocrinological standpoint, they could be home in 24 hours. Endoscopic brain surgery is also used to resect tumors inside of the ventricular system of the brain, colloid cyst, and other type of tumors that could be in the ventricular system. And through a small port in the brain, we can remove those tumors and relieve the obstruction of fluid in the brain. At Center for Neurosurgery Institute, it's our privilege to serve the community. We have a very successful group of neurosurgeons, physician assistants, and doctors, as well as the staff that's ready and happy to serve our community. We receive patients from extended areas, including international patients, but in addition to that, we are very happy to have the best results in the community.